Story 1. My dad woke up with severe back pain one morning after not doing anything strenuous the weeks/days leading up to it. My mom flipped her shit and finally put her foot down that he had to go to the doctor after him putting off going to a doctor for years, even for a routine checkup. That appointment showed a broken rib from a huge tumor on his spine, along with tumors around his buttocks/pelvis and upper back. Diagnosed with stage 4 lung cancer. 5 years and 100 treatments later, he's still kicking it. Story 2. Many years ago, when I was in my residence, a man entered ER with a hand in his forehead, walking by himself, asking for a doctor. You can imagine my surprise when I said, "Yes?" to him, removing his hand and showing his injury, a perforating hole from a bullet. He was quickly moved to surgery after that. Later I found the bullet didn't reach the brain, it was well buried into the skull bone. Story 3. My son. 6 weeks old. He was also 6 weeks premature. Only symptoms at the time of me bringing him to the ER was inconsolable crying and wouldn't drink his breast milk. Was told by others that I was just being a paranoid first-time mom. He probably has gas or was colic. My instincts just told me otherwise. Brought him to the ER. Triage asks me what my concerns are. I told them he wants stop crying and I can get him to eat. A couple hours later, my 6-week-old baby coded blue and went into respiratory failure. Code blue pediatrics will forever be the most haunting thing I ever heard. Since he was so tiny, they were having incredibly difficulty intubating him. Was being kept alive in between attempts with that bag thingy, unsure what it's called, and compressions. His diagnosis was late onset group B strep, sepsis, and bacterial meningitis. Had I not brought him in when I did and waited, my son would not be alive today. So yeah, listen to your instincts, you have them for a reason. Story 4. Saw a patient with minor cardiovascular symptoms and a slight pain in his upper back. The senior debated back and forth whether it would make sense to run a CT to rule out anything more serious. She finally decided to do it, and it turned out he had a massive aortic dissection and was basically wheeled right into the OR. Story 5. I'm a dentist. New point came in with what he thought was a mild ache in his teeth. Thought it was a toothache. Hadn't seen a dentist in years. Took a radiograph and the jaw bone around the teeth looked strange. Had him see an oral surgeon that day. Turned out was a very aggressive metastatic bone cancer, and died a few weeks later. Story 6. I'm a nurse, not a doctor, but we had a guy come in years ago asking for a medication to help him stop sweating. He said he had had a sore throat for about a week, went to a walk-in clinic, was diagnosed with strep throat, and put on antibiotics, but he was so sweaty and just wanted a break from it. He looked pale and was indeed sweaty, so we took him back and ran some blood tests. His white blood count was the highest I've ever seen, and he was diagnosed with leukemia. We sent him to another hospital for immediate treatment, but we were informed he died literally hours after arriving. Incredibly sad, I couldn't believe it. Story 7. 8-year-old girl gets brought in complaining about back pain she'd had for 3 months. Several different doctors had given her painkillers to no avail. After about 5 minutes, I asked her if she had any problems going to the toilet. She says it's foamy when she pees. Bone cancer. She made a full recovery, and from what I know is in her 20s now. But to this day I hate how she'd been suffering for 3 months, and no other doctor had bothered to even ask any more questions as to why an 8-year-old girl was getting severe back pain. Story 8. Patient's wife called. Patient had a temperature of 98.6. No other symptoms. I explained that was a normal temperature, but the wife said that's a fever for him. She said she felt like something was wrong, despite no other symptoms. I told her that I respect that, and that if she feels something is wrong, she should get him checked out in the ER. The ER doctor called 4 hours later and said they did all they could do for him, but he died of sepsis. He appeared to be normal when he got there but rapidly declined. That gave me a new appreciation that we truly can't evaluate someone thoroughly over a telephone.